We'll go ahead and get started, and I'd like to welcome everyone this afternoon. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Heather Johnson of Maine's Department of Economic and Community Development, as well as Commissioner Jean Lambrou, Commissioner of Maine's Department of Health and Human Services. We're here today to provide an update on the coronavirus situation across the state. But first, one note at the top. We are holding today's media briefing 1 hour earlier than normal because we know that the nation's attention in 1 hour from now will be focused on Minneapolis for the memorial service honoring the life of Mr. George Floyd. We, all of us, offer our condolences to the Floyd family and his entire community during this time. To turn to the coronavirus situation in Maine. Overall, Maine CDC is reporting 2,446 cases of COVID-19 across the state, an increase of 28 cases since yesterday. Overall, 291 individuals have been hospitalized and 35 individuals are currently hospitalized. Of those 35, 14 are in the intensive care unit and 7 are on ventilators. 95 individuals across the state have passed away with COVID-19, the same number as yesterday, and 1,739 have recovered, an increase of 40 recoveries since yesterday. Our case breakdown of the 2,446 cases is as follows. 2,181 of those cases are confirmed. That's 2,181. And 265 are probable. I'd like to just provide a quick update on some of the outbreaks in which Maine CDC has been actively involved. The first is an outbreak at the Eldridge lumber yard in York, where there remain 13 cases confirmed of COVID-19. The management of Eldridge Lumber has already undertaken universal testing, and we're continuing to work with them to ensure that they've got everything they need, as well as to keep tabs on the cases if any more were to arise. We've also been continuing to work on a pending outbreak at the Portland Family Shelter. The case counts there remain the same, which is to say 16 cases in total. And we continue to work with all the individuals at the family shelter, again, to make sure that they have everything they need, not just from a medical perspective, but as well from a social services perspective. I'd like to provide some updates on our activities around testing. Specifically, our activities are the number of tests that have been done most recently and specifically in the past 24 hours. Since yesterday, when we discussed testing and positivity rates, I wanted to start providing a bit of a snapshot on how testing is unfolding across the state on a day-to-day basis. Just yesterday alone in Maine, approximately 1,774 tests were done statewide. Of those 1,744, 1,559 were the PCR brand style test, and 185 were antibody tests. Overall, in the state of Maine, there have been a total of 61,187 tests done. Of those, 56,610, it's 56610, have been PCR tests. Our testing volume has ramped up quite significantly just in the past several days, to say nothing of the past several weeks in Maine. And cumulatively, for all the tests that have been done in Maine, the positivity rate has continued to fall. And this is one of those situations where falling is a good thing. Our cumulative positivity rate across the state is now 4.89%. So we continue to trend in the right direction. But what I'd really like to draw everyone's attention to is the positivity rate just for the tests that were done in the last 24 hours. Again, just in the last 24 hours, there have been 1,744 tests done. But for the moment now, I'm just going to focus on the positivity rate for just the PCR tests. That's because when we're in the midst of an active outbreak, it's that PCR number that gives us the most accurate and precise glimpse at what's actually going on. And as I mentioned yesterday, just alone, there were 1,559 PCR tests conducted. Of those, 34 were positive, which gives us a point positivity rate for yesterday of 2.18%. Just to put that number in comparison, the same number for other states is many times higher. In Massachusetts, for example, yesterday, the point positivity rate over the last few days has ranged from 6 almost up to 12%. Nationwide, that point positivity rate is still in the 10% range. Maine's point positivity rate is getting closer to one of the goals that we've had, which is to mimic what South Korea achieved, which was an overall positivity rate of approximately 2%. Again, we've still got more of a ways to go. Even though we might be getting close to getting there on a daily basis, we would still like to get the cumulative positivity rate, which currently stands at 4.8%, down even further. But these are signs that our efforts to expand testing, both in terms of capacity as well as the number of tests that are actually being done on a day-to-day basis, are getting us where we need to be going. So with that, I'd like to turn things over to Commissioner Johnson for an update on the reopening and economic development front.
Thank you, Dr. Shah. Good afternoon, everyone. Today, the Mills administration is announcing the acceleration of business openings in rural counties. These updates come in light of low case count trends in the 13 counties where the relative small number of cases has largely remained steady or decreased. We're announcing an additional group of businesses in these 13 counties that may open for safe operation on Friday, June 12th. Today's additions in the 13 counties include tasting rooms and bars opening to outside service only, gyms and fitness centers, nail salons, tattoos and piercing parlors. As in past practice, these businesses will have added health and safety precautions found in the COVID-19 prevention checklist. Additionally, the administration has been working on a plan to provide an alternative to the state's 14-day quarantine that seeks to protect the health and safety of Maine people and allow tourists and seasonal residents to safely support our businesses. This is an incredibly important step in how we safely reopen our economy. We've received broad feedback this week from lodging and other business owners, communities, and public health experts. We will review that feedback and work to incorporate it into the final plan. We plan to have a more detailed announcement early next week. We will continue to listen to the feedback and ideas from businesses, communities, and public health experts as we work to take additional steps to reopen Maine's economy safely. Thank you, and with that, we'll take questions.
Great, thank you, Commissioner Johnson. And today's first question from our colleagues in the media goes to Patrick Whittle from the AP.
Thank you very much. We have some access now to localized data about the virus in terms of where it's showing up in some zip codes. I would love it if you could speak a little bit to the sort of which areas are harder hit than others and why that might be. Also, on a semi-related note, some weeks ago you mentioned that with child immunization rates falling because of lack of access, there would be some kind of action from the state level to try to help get immunizations to children or to make it easier in some way. I would love to know if we're closer to knowing what that might look like.
Sure. So I'll start on the zip code level data, Patrick. The zip code level data revealed what I think many of us had suspected was going on, which is highly dense populated areas have more cases of COVID-19. That's based on the biology of how the disease is transmitted. That's what we would have predicted, and the data do bear that out. There's one important note that I would urge everyone to bear in mind as you're taking a look at those zip code data, which I urge you to do. which is given the way that our society is set up, people travel. And thus, even though your zip code might not have any cases in it right now, that should not change the way that you go about your day-to-day life. We still urge everyone to go about their day as if the virus may be around them. Just to take myself as an example, I live in one county, I work in another county, I shop in a third county, I get healthcare in a fourth county, and on the weekends I go to a fifth county to go hiking. That just, and I'm a pretty typical example of how much an average person across the state of Maine walks and travels across the state on a day-to-day basis. And so I would urge everyone to bear that in mind as you're looking at the zip code data. Even if your zip code doesn't have any numbers on the board yet, that shouldn't change the way you go about your day. And I will, to couple that, Patrick, those zip code data haven't changed the way that we go about our activities. We still go about public health interventions as if the virus were omnipresent across any zip code or across any county. In terms of childhood immunizations, we have been chatting with our colleagues across the country because we understand that now the US CDC is looking at taking a more national approach to boosting childhood immunizations. But we're working with specifically our public health nurses and our immunization program to try to see if there are ways that we can bring the immunizations to the neediest kids rather than relying on the kids needing to come to their physicians' offices. So that's a plan that we're working on right now, hoping to be able to have more to say about it soon.
And I might just add that we do have a chief child health officer at the Department of Health and Human Services who's working both with Maine CDC as well as across our programs with pediatricians across the state, as well as with our schools who are also sharing the need to make sure we have a plan. We'll hopefully be announcing some activities in the coming weeks.
Thanks, Patrick. We're going to turn next to Amy Brown from WERU.
Thank you, Dr. Shah. A quick question for you, and then I have a question I think would go to Commissioner Johnson. Do you have an update on the universal testing that was being done at the Tambrands plant in Auburn?
Thanks, Amy. So that testing is continuing to go underway. They've been doing it in phases, and they've sent those samples out for testing, and the results are coming in on a daily basis. There continue to be the same number of cases, which is to say 7 cases associated with that facility. We have not detected a dramatic uptick in cases as universal testing has gone underway.
Great. And Commissioner Johnson, we were contacted by a listener who has a family member that had just started working at one of the long-term care facilities where there's been an outbreak. The family member contracted COVID, but didn't yet qualify for the facility's healthcare plan or for paid leave. So now she's having to deal with all of the bills without any income. Does the state have any resources or offer any kind of protection for workers that are involved in these outbreaks that don't have health insurance or sick leave?
Actually, I'm going to defer that question to Commissioner Lambert. I think she's probably better able to answer that.
Okay, great. Thank you.
Yeah, thank you, Heather. So we have been from the start of COVID-19 concerned that people who do test positive get the care that they need. If you go to coverme.gov, that's CORVERME.gov, that is our website where you can find out information on the options available to you. We did, for example, just recently extend Maine Care or Medicaid coverage to anybody who's uninsured for the purposes of COVID-19 testing and treatment. So we urge all viewers who may be struggling to pay their bills for COVID-19 to go to coverme.gov.
Would some of that cover things retroactively for people who already were incurring these bills?
Typically, Maine Care does have some degree of retroactivity. There's a certain limit on days because you can't go back too far, else it's not really health insurance coverage. But I would just advise this person to go look at the website, there's a call-in number where you can call and get information and explore your options. I should also say our private insurance partners have also really gone out of their way to ensure that if you're covered, you get that treatment. So I'm hopeful that this person can find some help.
Thank you.
Thanks, Amy. We're going to turn next to Kevin Miller at the Press Herald.
Great. Thanks very much. Can you hear me?
Yep. Go ahead, Kevin.
Okay. I want to come back to the question about the new zip code data. Just is there anything that you can see in that data that tells you a little bit more about how the disease is spreading, especially when it comes to community transmission? I know you said it's not surprising that a lot of the cases are clustered in these more urban areas, but is there anything that you can elaborate on how the disease is spreading? And then also there was a cluster up in Medway, fairly rural town. Or any light that you can shed on that?
Sure. So Kevin, one of the observations, this is irrespective of the zip code data, but when we know that there's community transmission in an area, when we look at the spread, we look at it in terms of individuals, less about zip codes, because one individual can travel all the way from southern Maine up to northern Maine and bring it there. So we don't really look at our activities based on anything by zip code, but based on the questions around community transmission, the zip code data pretty well reflect what we have seen in terms of outbreaks. Particularly outbreaks in congregate settings, be they long-term care facilities or other types of facilities. And the zip code data really do bear that out. When we look at those, particularly in some of the areas where we know that there are a high number of congregate settings, the Bangor area, the Portland area, the Lewiston area, that is where we tend to see the highest concentration of cases, the number of cases. So the zip code data, as we were preparing them for analysis, making sure that we were adhering to patient privacy, as we were taking a look at all of those as it was going through the privacy filters, it pretty well matched up with what our expectations were. In terms of some of the quote clusters that you see, a lot of that, some of it is a function of just the number of individuals. In terms of the one at Medway in particular, Kevin, I'll check with our EPI team and see if there's something more to that story that I'm not aware of.
Okay. And one other just follow-up question. You mentioned the follow-up question to the TAM brands. Can you tell us, so why is it taking, these first 7 cases were reported last week, I believe. Why is it taking so long to get the universal testing done or get those results back? It seems like it's taking longer than in other facilities.
No, I'd respectfully disagree with the premise there, Kevin. It's taken about the same timeline as it would in a similarly sized facility. It's really a function of having folks come in for their shifts. So I believe that all of the testing itself was wrapped up yesterday morning. Today's Thursday. All the testing itself, the last round of swabbing, I believe, was wrapped up yesterday morning, so about 30 hours ago. And the last round of test results themselves would have been either ready last night or this morning. And part of the reason it's staggered in this fashion is that folks get tested as they show up for their shift. So this is largely the same schedule that we've seen in other large facilities, be they food processing or long-term care.
Great, thanks for that clarification.
You bet. Sure thing, Kevin. I'm going to turn next to Patty White at Maine Public.
Hi, Dr. Shah. Can you hear me?
Yep.
Great. I've got a question for you and for Commissioner Johnson, but I'll ask you first. I've heard from some people at the community level who are involved in public health efforts who say that it'd be really helpful to know the active cases at the municipal level so that they can respond more effectively. Is the CDC planning to release active case data at a more granular level?
So one note there, Patty, individuals who are healthcare providers, who are public health practitioners on the ground, if they are involved in the management of any individual or set of individual, they're already briefed on who those individuals are, what they need in order to be working with them from a public health perspective. Now, in terms of the active cases more generally, the question there is similar to what we've raised before, which is at what point do we provide data that could potentially compromise confidentiality as well? And so that's always the question we're keeping at top of mind for us. We haven't made any final decisions about whether we'll move in that direction, But I would also apply the exact same caveats as I did to Patrick's question, Patty, which is that whether it's the cumulative number of cases, the active number of cases, I strongly urge everyone to go about their day as if coronavirus were everywhere around them. One of the risks that I've heard from colleagues in other states is that moving in that direction has could lead to individuals taking a false sense of security by saying, well, there's no active cases in my zip code, so I don't need to abide by any of these recommendations. And that's not the direction we want to be going. So that's something I've heard from other colleagues. It's something that we're taking seriously, and then simultaneously making sure we weigh additional privacy considerations on top of that. One of the things that differentiates Maine from even our immediate neighbors is both that we have a lot more zip codes and towns, and by implication, a lot of places with zip codes and towns with very few people in them. So that also adds to the privacy calculus. That's one reason our analysis and our algorithms for privacy were particularly challenging.
In terms of making that decision about whether to release that data, is it dependent on just there being enough cases, kind of like it was for making the decision to release just the total case numbers at the zip code level?
That is a very big part of it. That is a very big part of it.
Okay, great. And Commissioner Johnson, I wanted to ask you about some of the changes to the rural reopening plan. Can you just explain the difference between, or why outside service for bars and tasting rooms is limited to 13 counties and not the entire state, because restaurants across the state can offer outdoor service?
Yeah, actually, I'm gonna defer that question to Commissioner Lambrou as well. That is really a public health decision and not an economic decision, Commissioner.
Thank you. So we have said all along as we approach reopening that we want to look at our data, study the trends, consider how much we're dialing up and dialing down different activities. And I think at this moment in time, we want to pause on additional reopenings in the 3 counties where we've had community transmission and had recently expressed some concerns about indoor dining and other activities because of those trends. We assess this on a day-to-day basis. We'll be reviewing and revisiting that in the coming days and weeks. And as soon as we have any changes, we'll let you know.
So in terms of outdoor service, so if restaurants are allowed to do outdoor service across the state for bars and tasting rooms, are you saying that they're not allowed to in certain counties just to kind of, just because of community transmission and trying to minimize how many people are getting out there and congregating?
So I'll pull back a little bit to the original plan for restarting the Maine economy. We decided that as we were tiering and phasing in different sectors, we would begin with restaurants and go to bars later, not because of indoor or outdoor settings, it's because of the nature of those organizations. If a bar also serves food, there's tables, there's an ability to space people, there's not as much congregation when you don't have tables. It's just an easier way to manage flow and ensure those sort of physical distancing practices, which is why we chose to do bars in phase 3 or stage 3, I should say, and restaurants in stage 2. What we're doing, again, in a way that allows for us to study and test and make sure we're doing a good job at containing the spread of COVID-19 is pulling up the start date for certain bars, outdoor seating in those 13 counties where we've had demonstrable success in containing the spread of COVID-19. Again, we'll assess it, and should trends continue the way Dr. Shah has described it, we will revisit that decision. But today we're starting by moving up the start date for those bars and tasting rooms in those counties from July 1st.
Thank you.
Thanks, Patty. We're going to turn next to Lee Nelson from Maine Center.
Yes, thank you, Dr. Shah. I kind of have a 2-part question here. Number 1 part is, are you continuing to get more people to do testing for out-of-staters coming in? And the second part of that question is, we have a big group of out-of-staters coming tomorrow from Washington, including the president. And curious about the specifics of testing or not testing, or what is being planned with regard to COVID and their trip here. The president has said he's not really fond of wearing masks, so just wondering what the plans are there.
Sure thing. So I'll start on the testing piece. The testing that is done across the state is done when we report our numbers of testing. It includes all comers. What we've seen with respect to a lot of the out-of-state residents is that of the out-of-state residents who test positive, the overwhelming bulk of them are New Hampshire residents who happen to get their health care in Maine. And that's been a trend that we've seen from day one, and it continues through to this day. As to the latter, I'll turn it over to Commissioner Lambert. And
apologies. Similar to every state where there is a visit from the president, there's lots of preparation that goes into that, lots of discussions. Those discussions have been happening with the appropriate officials. I think we, in addition to ensuring that Maine residents are safe, that these visitors are safe, we also are adding a public health component to it.
Great, thank you. And we'll turn next to Caitlin Andrews at the BDN.
Hello, everyone. Good afternoon. I also have questions about some of the zip code data. I guess specifically what I want to know is, Dr. Shah, do you see ever there being an incident where knowing how many cases per municipality or zip code would influence the CDC's public health response? And I guess, what do you kind of see as the value in releasing this data, even though the CDC seems like it's still going to be responding, as if like the virus is omnipresent and on a county basis?
Yeah, you put your finger right on it, Caitlin. When we are investigating outbreaks, what the background prevalence rate is doesn't affect how we go about making recommendations for infection control, screening, retesting, PPE provision. We operate as if the virus were everywhere and potentially could infect anybody involved. So when we're evaluating, for example, whether a staff member might have been someone who carried the virus in, we're not looking at what the background rate is. We're looking at what we know to be true from our testing data for that individual. So the zip code level data, or even the county level data, when you're in the midst of a major international pandemic, as we are, our baseline assumption is that risk is everywhere in an outbreak setting, and that any individual we come into contact with when we're evaluating the situation, be they a staff member, a resident, a contractor, anyone, we always assume that they have got some degree of risk and exposure. So we don't go into an outbreak at a new facility and say, well, let's take a look at the zip code level data first. We go in assuming that the virus is everywhere around.
Okay, and so do you see any value in having this data being tracked and released?
What I will say is that what I urge everyone to do is go about their day as if the virus were everywhere around them. In our modern world, being as we are in 2020, folks travel across the state. They can live in one place, work in another, get healthcare in a third, shop in a fourth, go outside in a fifth, see family members in a sixth, all in the course of a day. And so what zip code level data are simply just where the person's stated residence is. But it says nothing about the travels that they may have had across the state and the individuals they may have interacted with. I admit that zip code level data are interesting. It's intriguing to see what zip codes have A versus B. But from a public health perspective, from an operations perspective, and from the advice that I would ask everyone to follow for preventing getting COVID-19, from keeping your family members safe, the tried and true things we've talked about for the past few months: physical distancing, wearing face coverings, washing your hands frequently, keeping elderly folks or those who are medically vulnerable safe. That is where we should be focusing, rather than checking zip code data before you go on a family trip. I'm going to turn to Megan at WMTW next.
Thank you. My question is for Commissioner Johnson. I understand that you're currently evaluating an alternative or alternatives to the 14-day quarantine for out-of-staters. And I know that there's really no decisions that have been made yet, and you're reviewing feedback from the lodging industry. But could you kind of give me an idea or give us an idea of what that might look like? Meaning, would you reduce it to a certain time frame, or would you offer testing? What was some of the feedback that you got from the lodging industry that you're taking into account, and what might the alternative look like?
Yeah, Megan, so thank you for the question. As we've looked at this challenge, right, for the last couple of months now, we've tried to weave through the public health components and the economic components and find that sweet spot there where you can optimize your economy while you keep Maine residents safe and frankly tourists safe. We're hearing in tourism studies kind of across the country that people are only going to travel to places they feel safe and feel like the protocols are in place to keep them safe. And so part of this is about consumer confidence for tourists as well. And so, I think there's probably not one answer, but likely layered answers that create multiple points for opportunity to try to keep people safe and to allow for capacity in our tourism businesses. As you look at what other states are doing, we're seeing other states at a variety of places. Very few states look like ours from the perspective of base population to population during peak tourism seasons, and the delta between those two is pretty high. So if you look at places like countries like Iceland, states like Alaska, Hawaii, Montana is one. There are a few others, right, that have these peak summer tourism seasons. There's a range of things happening, and so we are trying to look at those. But one thing that became pretty clear very early on is the lodging owners said to us, capacity restraints in July and August would be a real challenge for them because those are their peak seasons. And so we're looking at alternatives that don't create artificial capacity restraints on hotels. Obviously, I think we are all working on projections for this year's tourism season and what that looks like. And who will be traveling. We're also seeing indications that travel will be later this year than in traditional summers. So we're trying to find opportunity there as well.
Thank you. And Caitlin, I wanted to go back to a question that Caitlin Andrew raised about the value in these data. And among many other reasons, Caitlin, we also, of course, just want to be transparent with the data that we've got. When we've got data, once we can privatize it, if you will, to make sure that privacy is maintained, what I mean by that, once we've got that and the privacy can be maintained, we want to put it out there. So there's always that baseline value of transparency. I heard your question to be about the public health value, but I shouldn't neglect the fact that there's always the value of transparency in sharing the data that we've got.
Thank you, Dr. Shah. I appreciate that.
Yep. Again, keeping privacy in check. I'm going to turn next to Kit Harrison from Mjumbo, Africa.
Good afternoon. Hi. So I was looking at the data on the CDC website, and it shows now that well over 1 in 4 people who have COVID-19 in Maine is a person of color, even though only 1 in 20 Mainers is a person of color. So I have 2 questions. One is that Maine seems to be one of the only states that doesn't publish numbers of death by race and ethnicity, and I wondered what the reasoning was and what you were thinking about. And my other question is, what new proactive measures are being taken by the various departments to specifically address this disproportionate impact, allocate resources, prevent it from growing? Thank you.
Sure thing, Kit. I'll take the first part. Commissioner, if I could ask you to grab the second. So, Kit, on the very first one, we will very, very, very shortly be publishing those exact data that you noted. But you may ask then, why not yet? Well, here's the exact reason. Every day I announce when an individual has passed away, and I announce the general age range, the gender, and the county of residence. If we were to add on top of that on our website, say, for example, that on that particular day, the number of Latinx people happened to also go up by 1 in a particular county. I will then someone could very easily intuit that the person that I said at 2:00 was also of Latinx heritage. And then if we add on additional things that have changed, for example, only 1 zip code goes up by 1 in that county, then we've also then revealed the zip code that they were in. And so similar to as we did with the zip code data, we needed to make sure that we had guardrails in place so that we not only prevented accidentally identifying someone with COVID-19, but in this case, identifying someone who passed away as well. And again, this just speaks to the fact that Maine has had relatively few cases and a high number of zip codes. When you put all of those things together, we have to be extra, extra careful. Just because we're in a pandemic doesn't mean we can do away with the everyday privacy protections that we've all come to know.
I understand it. Could I quickly just ask something? I understand what you just explained and it makes sense to me. But you did just say you were thinking about very shortly publishing the data. So could you just tell me why now?
Yes. So we run scenarios under which we think of our data and informatics team spends a big chunk of their time looking at scenarios under which the hypothetical that I just noted for you could actually come true. And when we run out of scenarios where that could happen, that means to us sadly, it means for us that there are a sufficient number of individuals who have passed away so that those types of hypotheticals that I just ran you through could not accidentally reveal somebody. I say that knowing it's an unfortunate number because it sounds grim, but once we've reached a certain threshold, that means that the possibility of identifying somebody inadvertently who has passed away of COVID-19 becomes very, very low within acceptable, in conformance with privacy policies. And that's the stage we're at now. And thus we hope to be releasing those data on our website very soon.
Thank you.
And to your second part of your question, what are we doing? We find the racial disparities in COVID-19 alarming. This is a code red activity for the Department of Health and Human Services. Seeing what's going on the ground in our communities, hearing the anger and frustration, and frankly, concerns that racism may be part of the problem that is happening in the state of Maine has led us to a call to action. We are going up and down the system. Number one, for COVID-19, looking at how we can better educate people to protect themselves, to protect their neighbors, to protect their communities, engaging with people in these communities, community health workers, others who can make sure that we are sufficiently giving people the tools to keep themselves and their neighbors and their families safe. Second, we're making sure our testing strategy is sufficient. We want to make sure that there's no barriers to testing for people of color in the state of Maine. We're looking hard at our testing strategy. Third, we want to make sure that they're getting the health care that they deserve because we do have a high quality healthcare system in the state of Maine. How do we ensure that everybody has equal access to that health system? So we're working with our healthcare providers in education, our systems on what more we could be doing to make sure that they get the healthcare that they need. But there's also a social services component. We've heard in some communities there's a real fear of going into isolation because what happens to your parents or your children and who's going to care for them? That may mean that they're not taking care of themselves and inadvertently because of the barriers and the systematic problems, not being able to prevent the spread of COVID-19. So we are working on this strategy for COVID-19, but I will say it highlights the fissures and fractures in our healthcare system that have been longstanding. So this is part and parcel of what we're trying to do in the department, and the state, I should say, to really elevate the issues that have been highlighted by COVID-19 to get at the root causes, some of which are racism.
Thank you for that question, Kit. And this afternoon's last question goes to Emily Tadlock from WABI.
Hi, my question is for Commissioner Lambrou. You kind of touched on this a little bit with Lee before, but you said that you guys are having a public health response to President Trump's visit. I was just wondering if you could elaborate on that a little bit, maybe for not only the residents of Guilford, but people who are thinking about traveling up to that area tomorrow. I don't know if you could elaborate on it for us a little bit.
As with any presidential visit, there are protocols that are followed about the contact between the traveling crew and the people here on the ground in the state of Maine, and that's handled with great care and great precision for both the protection of the residents of the state as well as the protection of the team that's coming to visit. We use the same protections for public health that are recommended by the US CDC. That includes recommending physical distancing, cloth face covering when possible, trying to make sure that there's good hand hygiene, to make sure that our crowds are not over the size of 50 in the state of Maine. So we are urging people in Maine to do what they usually do and what they've done very well to date. We're proud of the fact that we have done well relative to other New England states, actually all Eastern Seaboard states, in terms of our COVID-19 response. And we are hopeful that anybody visiting the state of Maine respects that as well.
Great. Thank you, Commissioner Lambert.
Can I just have one more follow-up question just to that? You spoke about limiting the size of crowds. Obviously, that's in the governor's executive order. Is there a plan to limit sizes of crowds, or some sort of crowd control plan in place?
I would recommend that I defer you to the Department of Public Safety and others, because crowd control is not necessarily in the department's purview.
Thank you.
Great. Thank you, Emily. And I'd like to thank everyone for joining us this afternoon. As we close, I will just acknowledge that today is a challenging day, a difficult day for a lot of folks. And I don't know about everyone watching right now, but given how quickly the world is moving, I speak for myself only, but sometimes I feel as if I have to run as fast as I can these days just to stay in the same place. And as we go through the day, as we go through the remainder of this week, I ask everyone to do two things. Please recognize that all of us, each of us, is grappling with and dealing with quite a lot right now. And even though I say this a lot, today I really truly mean it. Please be kind and take care of one another. Thank you very much, everyone. We'll talk soon.